Hello everyone, welcome to join us for the second segment of our discussion on colonoscopy. In the previous video, we delved into the importance of colonoscopy as a key medical procedure that offers crucial insight into the wellness of your colon and rectum. The process employs a colonoscope, a slim, flexible device equipped with a video camera, a light source, and various channels for water, air, and specialized instruments. Now, you might be wondering, under what circumstances should one consider a colonoscopy? A colonoscopy may be preventative, diagnostic, or therapeutic, and often it's all three of these. Let's first talk about screening. Most people will have their first colonoscopy for routine cancer screening. Statistically, your risk of developing colorectal cancer goes up as you age, which is why the American Cancer Society recommends regular screening at least by the age of 45. You may not have any reason to suspect you're at risk of colorectal cancer, but when your statistical risk goes up, it's best to check anyway. Colorectal cancer often doesn't cause any symptoms until it's too advanced to treat effectively. You may be due for a colonoscopy for cancer screening if you're older than 45 and haven't had one, hadn't had one for 10 years, had tissue removed during your last colonoscopy, have a family history of colorectal cancer, have an inherited disease that raises your risk, such as familial adenomatous polyposis, or FAP, or Lynch syndrome, or have inflammatory bowel disease. Let's take a look at diagnosis. Some people have colonoscopies because they have symptoms that a healthcare provider must investigate more closely. A colonoscopy provides a better view of your large intestine than any other types of imaging tests that don't go inside your body. Your doctor might need this better view to figure out what's causing your symptoms or confirm their suspicions. Sometimes they might need to take a tissue sample or biopsy to examine under a microscope to make a diagnosis. They can do that at the colonoscopy. Symptoms that might require a colonoscopy include unexplained changes in your bowel habits, such as diarrhea, constipation, or incontinence, unexplained rectal bleeding or discharge, unexplained persistent abdominal pain, or unexplainable weight loss or lack of weight gain in children. Diseases or conditions that colonoscopy might help diagnose include chronic colitis, such as ulcerative colitis or Crohn's disease, intestinal ischemia and ischemic colitis, diverticulosis and diverticulitis, ulcers and perforations, large bowel obstructions, or colorectal polyps and colorectal cancer. Let's delve in deeper into the applications of a colonoscopy. The primary application is to screen for colorectal cancer. This type of cancer is the third most common and the second leading cause of cancer deaths in the United States. If an individual falls into a high-risk group for developing colorectal cancer, healthcare providers might suggest a colonoscopy. Since colorectal cancer can develop without noticeable symptoms, proactive screening plays a critical role in early detection. During the screening process, any suspicious tissues can be removed and further examined. Other applications include investigating symptoms like chronic constipation, rectal bleeding, and abdominal pain. They are further recommended for monitoring diseases like Crohn's disease and ulcerative colitis, both types of inflammatory bowel disease. Beyond just diagnosing conditions, a colonoscopy can be used to treat certain issues. Polyps can be removed during a colonoscopy to prevent them from becoming cancerous. Also, bleeding from the colon can be stopped, and narrow areas or strictures can be dilated. Getting a colonoscopy probably isn't your idea of fun, but it could save your life. You should get a colonoscopy for the following 6 reasons. Number 1. Colon cancer can happen to anyone, even otherwise healthy people with no family history of the disease. And though most people who get colon cancer over 50, it's on the rise in younger adults. Number 2. Colonoscopies can actually prevent colon cancer. During a colonoscopy, doctors can both spot and remove small growths called polyps. If they're left undetected, these polyps can grow and eventually become cancerous. Number 3. You can't rely on symptoms to tell whether you have polyps. That's because polyps and early-stage colon cancer don't cause symptoms. This makes getting a colonoscopy especially important. Number 4. There's a reason doctors call colonoscopies the gold standard of colorectal cancer screening methods. They're incredibly accurate, detecting more than 95% of cancer cells in large precancerous polyps. Number 5. Colonoscopies are also very safe as long as they're performed by an experienced specialist with rare complications. Number 6. The preparation process for a colonoscopy has improved significantly over the years with better tasting laxative solutions and less restrictive diet guidelines. So take the time, your health is worth it. In conclusion, a colonoscopy is an examination of the insides of your large intestine or colon. It's helpful for diagnosing gastrointestinal diseases such as inflammatory bowel disease and colon cancer. It can also treat and prevent colon cancer. Healthcare providers recommend routine colonoscopies for middle-aged and older adults to screen for cancer. Thank you for watching.